you've probably just been diagnosed with scoliosis, or you're at least going to get one. So the fact that you're watching this video right now means you're on the right path. Scoliosis, especially if you're a young adolescent, progresses extremely quick. That's the main crux of the problem, and addressing it now is one of the best things you can do. If you have a doctor and they don't give you imaging right away or as soon as possible, and they sort of just say, oh, we'll keep an eye on it, yeah. And they don't really tell you what's going on, move, find another doctor. Find someone who is a lot more specialised with scoliosis and knows their stuff. In terms of scoliosis, you can't just wait and see what happens, because in most cases, it progresses and just gets worse. Observing is fine as long as it's done alongside some form of treatment or action. But if you've got a doctor who's just going, yeah, keep an eye on it, don't bother. And I'm not saying this to scaremonger anyone or scare you into doing things. I'm just saying this because you need to know it to know what you're dealing with, to make you aware and so you know what to do next. So here's the 4 things to do after you get diagnosed. Number 1 is never wait. Find clarity. Number 2 is get the right imaging and information. Number 3 is understanding the risk of progression. And number 4 is start the appropriate treatment early. So number 1 is getting an x-ray. Get one as soon as possible. When you get diagnosed with scoliosis, it's not just simply about knowing whether you have it or not. There's more to it. You need to know the Cobb angle, how big the angle of the scoliosis curve actually is. You need to know what kind of scoliosis it is, when it came about, know when and how it's going to progress. Scoliosis is quite based on context. Simple factors like, say, your age can literally determine the outcome of your scoliosis in a few months to years. Right, so you've taken the x-ray, perfect. Now you just need your doctor or specialist to tell you what kind of scoliosis it actually is. Is it congenital, meaning that you were born with it? Was it neuromuscular scoliosis, meaning it was brought on by a neuromuscular disease? Or is it idiopathic scoliosis? This is the most common kind. What does that mean? Idiopathic means it arose spontaneously without any known cause. And yes, of course, that one has to be the most common kind. Yay. See, I get lots of people say to me, oh, you were born with scoliosis. What was it like as a kid? And I say to them, oh, I wasn't born with it. It just came out of nowhere when I was a teen, started curving out of nowhere. And they just sort of look at me like, oh, okay, that's not good, is it? But for now, I'm going to focus specifically on idiopathic scoliosis since I've dealt with it myself, and again, it's the most common. So now that you know that, your doctor or specialist should show you what the Cobb angle is. The Cobb angle is basically a measurement of how big the curve is in degrees. In layman's terms, how big is it? They need to understand how large it is, the location, what kind of curve it is, and most importantly, how likely is it to progress and by how much? You see, a lot of the time, knowing how much a curve will progress is actually more important than the diagnosis itself. I remember having my x-ray, and what my specialist did was he x-rayed my hand, because when you have an x-ray of your hand, you can figure out how much growth is left in your whole body. Crazy, right? And he used that to help him figure out how much my spine would progress more as I grew without any physio or treatment. There's some real smart people in there. The thing that really catches people out with scoliosis isn't even the scoliosis itself sometimes. It's literally how fast it progresses out of nowhere. Start of the year, it's like, what, a couple of degrees, and at the end of the year, it can be at like, what, 40, 30, 50. Some big number, it's absolutely atrocious. Here's an example of how quick it can just change out of nowhere, and this example is me. When I was around 13, 14-ish years old in 2020, my parents and I noticed that my shoulders were a bit uneven, and we looked all the things up and we realised, hang on, this could be scoliosis. I was crapping myself, but I went to the hospital anyway for an x-ray. Got the x-ray done, but they never gave it back to me instantly. They said they'll give me an appointment in a couple months. Many months passed and nothing happened. Then it got to a year and we were thinking, hang on, something needs to be done here. So we just skipped that and went to a private scoliosis clinic where I got my diagnosis at around 15 years old. And oh my God, got the x-ray back, got told what kind of scoliosis it was, everything, and my curve had increased to around 49 degrees. Absolutely ridiculous. Just because I didn't know about my scoliosis sooner completely changed the outcome of what non-surgical treatments I needed. And that is why I always repeat to people, never just wait on it. I know it was the big era of the big disease which was ruining everything, and yes, the NHS was quite overrun, but my God, come on. Funny story this, while I was getting my treatment privately, we did actually in the end get an appointment from the NHS. So we went back to see and just tell them what happened. I went to a hospital called Orsett Hospital, and it was the most grim, depressing hospital I've ever been to. Or at least it was up there. It reminded me of a nuclear bunker, or... Wait, no, I know what it reminded me of. It reminded me of Call of Duty Nuketown. That's what it did, even though I'd never played that game-ish. It was a dump. We went into the office and they were like, oh, there's the curve. Yeah, it's progressed quite a bit. Keep an eye on it, blah, blah, blah. You know, the normal stuff they say when they don't really understand it. And my mum was like, well, we were waiting, and since that x-ray you never gave us, it's completely changed. Thank you very much. You know what else makes this even worse? I don't know if it's a false memory or something. I remember coming out of the x-ray room on my first x-ray when I was around 13, 14, and I swear to God, I saw my x-ray on the screen. It couldn't have been someone else's. Maybe, I don't know. But it was on the screen. It didn't look that severe, or nowhere near severe as it was in the future. It was right there! So that x-ray just sat on someone's desk. Anyway, rant over. This isn't about me, this is about you. So you know you got scoliosis, you know the severity, you've seen it, you know how big it is, you know how it's going to progress, but what the hell do you do now? A good doctor or surgeon will automatically prescribe you the right treatment for your scoliosis specifically. As for me, it was special kinds of exercises to do every day alongside bracing. We'll get onto what that is in a moment. Since my curve was more severe, we couldn't really reduce it. All we could do is stabilize it and stop it from getting worse as I was still growing. And since my curve was classed as severe, that also meant surgery was up for the discussion, which at the time was absolutely terrifying. So my specialist referred me to a private surgeon who told me if it was a good idea or not and what to do. Then he himself referred me to an NHS surgeon who, by the way, did an incredible job. He was so good. And by the way, this is where the NHS really shined. The hospital I stayed in was the complete opposite from the last one, and it was probably the best hospital I had ever seen. I did not feel uneased when I was in there. I felt comfortable. Everything was nice, balance of colours, everything was modern. It was perfect. Not only that, after my surgery, I was also given another brace, which was far more comfortable, and it was to give me stability as I was recovering. Everything felt perfect. But keep this in mind, if you have a severe curve like I did, surgery isn't automatically a yes. It is merely just a discussion and a consideration. Surgeons, specialists and doctors know that you should always do the non-surgical treatments first if applicable. Surgery is a last resort option. I'm not a doctor, so only take my word for a pinch of salt. I'm not going to give you the precise guidelines on what you should do for your curve at your stage. I don't know what your scoliosis is like, and not only that, scoliosis is context-based. But here's something a bit more general. The smaller a curve is, usually means the more effective a treatment is. The main goal is we want to stabilize and minimize the curve as much as possible. One of the main non-surgical treatments which does great is the Schroth therapy. Schroth is a specialized type of physiotherapy where you are given specialized exercises. This means special 3D exercises. You are usually given postural awareness exercises and corrective breathing exercises alongside that. What these aim to do is elongate and stabilize the spine, not magically straighten it out of nowhere like a miracle, but to halt progression and increase spinal stability. Schroth works best when individualized, basically meaning it's personal and custom tailored to you, and it is especially effective when combined with other treatments, and done consistently. Schroth has different goals for different people. Schroth's goal for me specifically wasn't to straighten the spine, but to simply just halt progression as I was still growing and keep it stable. And it was also to do this all while I was still bracing to help that as well. And on to the next treatment is bracing. Bracing is by far one of the most effective treatments as well. Bracing means wearing a scoliosis brace. So it's basically like a big corset you wear around your body, and it's like a hard shell. It's custom built towards the user. I like saying user because it makes it feel like some sort of space age cool device. Reminds me of Iron Man. And it's custom molded to push different parts of the skeleton back into place. Think of it the same as the braces you wear in your teeth, because look, I've got some as well. Oh Christ. Your braces in your teeth slowly pull and push different teeth over time to give you a new smile and give you better alignment in your teeth. This is basically doing the same but with your bones. It only decreases the curve when being worn, but over time it stops the curve from progressing if worn consistently. Most of the time it's used to stop progression, but there are some cases where it has in fact reduced a curve. It happens to people, and it's usually in people with less severe to more moderate curves. All sorts of factors go into play there. Bracing is most important in adolescent people with moderate to severe curves who still have lots of growth left. That is why timing is so important. The earlier it's used when appropriate, the better the results tend to be. Bracing may not have reduced my curve, but it stopped it from getting worse in the phase it was progressing the most. And had I not worn my brace, I would have had to have a longer and bigger surgery on my spine. More fused portions in my spine and a longer recovery maybe. Just more ag. So by wearing my brace, I have saved myself safety. My surgeons have had an easier time operating on me. Less of my spine has had to be fused, so a faster and maybe less painful recovery for me as well. So hey, I guess a tiny bit more spine mobility left. Happy days. Of course, that's not guaranteed for everyone because, you know, everyone's different. And surgeries are different. There's all sorts of complex things, but wearing your brace when you're supposed to always helps you. Wearing your brace, even if it seems futile, is important. I will say, at the start, these things are hella uncomfortable to wear. I absolutely hated it. I actually had to stop wearing it at school for a point because I couldn't concentrate. But it gets to a point where you get so used to it that you weirdly prefer wearing it. It's like Stockholm syndrome, but it just feels so good being propped upright and you just feel, you know, so aligned. And when you take it off, you feel like, oh, this don't feel right. I feel like I'm collapsing. Ugh. So when you get used to it, it doesn't tend to be too bad. And you actually prefer wearing it, you know. Strange, but works. With the correct treatment and timing, some people's curves may regress a little. But even if they don't regress and the curves stay the same, people still live out happy, active, and fulfilling lives despite having scoliosis. They end up in a much better position than if they were to just monitor scoliosis and not do anything. And hey, a lot of people don't actually end up having to have surgery in the end. And if you've just discovered your curve and hey, it's not too bad, oh my god, you have struck gold, my friend. Because the less severe a curve is, the more effective a treatment can be. You've found it at the perfect time, so take action. And in the meantime, stay fit and strong. It does wonders living with scoliosis and being fit and strong. And I can tell you that from experience. So the main takeaways from this video is to get proper imaging, understand what scoliosis you have, understand the progression risk, and work with people who are actually specialized in scoliosis. And I know that is a lot to take in, but just take a deep breath, relax, and just remember, you're on the right path. I sure hope this video has helped you in some way. Keep moving forwards and stay strong.